Distinguished guests who have made the time to join us today. Thank you all very much. You're all distinguished. Would like to first of all acknowledge the presence of our chairman and group MD of Consolidated Hallmark Insurance PLC, Mr. Eddie Efekoha. Good evening, sir. Would also like to acknowledge the presence of the representative of the Honorable Minister of State for Health, the Chief Medical Director of the Federal Medical Center, Ibutimeta, Dr. Adedamola Dada. Good evening, sir. Thank you for joining us. Would like to acknowledge the presence of some of our panelists, Dr. Leke Oshuni, Chairman HEMCAN, Health and Managed Care Association of Nigeria, Mr. Soji Oyawoye, MD Resources Intermediaries, Dr. Yetunde Oyalowo, one of our panelists, is also in the building, as well as the moderator of our panel section, Dr. Kelechi Okoro, is also somewhere around. And would also like to acknowledge the presence of the representative of the Lagos State Commissioner of Health, the General Manager of LASHMA, Lagos State Health Management Agency, Dr. Emanuela Zamba. Good evening, ma'am. And would like to acknowledge the presence of Mr. Yemi Fashion, the founder of YF Foundation, and the MD of Capital Express, Mrs. Bola Odukale, also a director of Hallmark Hmo, Mr. Lampe Omoyele, also a director of Hallmark Hmo, and all you other distinguished ladies and gentlemen. Again, thank you so much for joining us in this stakeholder session. My name is Neka Uke. I have the honor of moderating this evening's session. And here we're particularly going to be talking about how to strengthen healthcare systems in Nigeria. This session is being hosted by our good friends at Hallmark Hmo. And we're going to be going through a very short but hopefully detailed set of conversations around what we can do to improve healthcare systems in Nigeria. The numbers are there, the statistics are clear. In countries where healthcare is a priority, there's also enhanced quality of life as well as improved economic development. So what can we do, especially in the wake of the COVID-19 pandemic? We've seen how Nigeria and the rest of Africa has fared. What can we do to improve our healthcare system and to insulate and ring fence ourselves from the next pandemic or the next global or national health crisis? To start off the today's proceedings, we're going to have a welcome address from our chairman and group MD of Hallmark Hmo, Mr. Eddie Efekoha, who will be joining us briefly. Please keep clapping while he gets to us here.
Right. Good afternoon or good evening to everyone. I know that the recognition has been done, but you permit me to do a bit, and then I can key into the protocols as already been done by the MC for our event. We have a representative of the Minister of State for Health, Senator Dr. Olorunibe Mamora, who today is represented by Dr. Ade Damola Dada, who is the, place your hands together for him. Thank you very much, sir. Thank you for coming. We also have a representative of the National Health Insurance Scheme, the Executive Secretary, Professor Sambo, who is today represented by Mrs. Evelyn Wondo. Thank you very much for being here. Thank you. And Dr. Kehinde Mufu Yao. I hope I'm correct, please. Permit me. Right. We have the Commissioner for Health, Lagos State, here represented by Dr. Emanuela Zamba. Thank you very much, madam. Thank you. Dr. Zamba is in her own capacity as the General Manager of LASHMA, our second regulator. I hope you deal with us gently. I think I need to recognize someone that hasn't been recognized. He's coming from the group chairman representative. Is Dr. Lai Fatono is in the house. Thank you very much, Dr. Fatono, for joining us at this event. I know I have another of my director, Mrs. Bola Udukale. Thank you very much for joining. Where are you sitting? I can't see you. Where are you? Okay, so I think you know where to join. I think Dr. Fatono is somewhere there. You may want to join. Yeah, thank you very much. Right, we have our guest speakers in the house. Thank you very much for coming, and our panelists. I'd like to recognize all our partners that are also here, other directors of Hallmark Health Services Limited, popularly we are called Hallmark Hmo, and other directors in the group. Thank you very much, ladies and gentlemen. It's actually my delight to be here and to welcome all of you to this event, which is the maiden edition of a stakeholders engagement organized by Hallmark Hmo, a subsidiary of Consolidated Hallmark Insurance PLC. Some of us have been here before 3, and between 3 and 4, we've been having a bit of cocktail. We know time is precious. Thank you very much for making our time to be here. We know how busy you are already. We know that time is money, as they say, and it is true. So thank you. We hope that the session will kick off now speedily, and it will also be benefit for the time spent. Hallmark Hmo is a subsidiary of Consolidated Hallmark Insurance PLC. That actually came on the back of the fact that we saw a gap. We're already in insurance business since 2007 when we had some consolidation in the insurance industry, and we pitched our tent within the general insurance space, and we've been doing that very well. And we realize if you check the Insurance Act, you will see that there is health insurance. But fortunately, unfortunately, we have health insurance being regulated separately by the National Health Insurance Scheme. And we thought that we needed to offer our customers. And so we decided to veer into health insurance and apply for a license. Unfortunately, and we are grateful to NHIS for granting us that accreditation to offer health insurance to our customers. Today, within our group, we offer general insurance, and I know that NHIS also ensures that their licensees carry professional indemnity. We also do that. I especially want to mention that. But within the group, we do financial services as well, having been licensed by the Central Bank of Nigeria. We're also doing micro insurance by way of life, and a little bit more at the end of the day. So all of this we do. But today we are gathered here to look at something very special. We have joined the health care industry. We want to add our little quota. We know that the needs of the generality of Nigerians is important to all of us, and anything that we need to do to strengthen the system will be a welcome development. So we have therefore gathered here this afternoon in order to discuss a topic, strengthening our healthcare system to improve well-being. We know how difficult, how challenging this has been, particularly on the back of COVID-19, but thank God we are getting out of it. I think Nigeria has been blessed, but that is not to say that we haven't had our own share of the challenge. But if we look at the records and our performance, Nigeria cannot be said to have done very badly. I think we did very well with the COVID. It just could be better because there's always room for improvement. Thank you very much. Therefore, in trying to strengthen this healthcare system, there's need to look at various factors, including the adequacy of health facilities, availability of adequate health equipment at the facilities, the accessibility by a generality of Nigerian populace, and measures to address inadequacies, including advocacy for improvement through budgetary allocation, professionalism, and their capacity building opportunity and adequacy of healthcare practitioners, amongst other factors. We do say something here, and courtesy of our media people, that indeed healthcare comes before anything else, and it couldn't have been more apt than that, and that is why we are here. Health is so important to all of us, and anything we need to do to contribute to that and make that meaningful to all of us, I think the better we are. Hallmark Hmo, in its short lifespan, has introduced affordable health plans tailored to meet the healthcare needs of corporate and individuals alike. I believe that my colleague, Mrs. Oladotun Adiogu, is in the house. She is the one who has invited all of us here. I guess she will be speaking to what they do and the products they have on offer. I believe distinguished speakers and panelists will also add their own voice to this debate and this discussion this evening. And I believe at the end of the day, we will all be better off than what we were when we came in here. I therefore want to invite all of us, our valuable partners in the healthcare services of this great country, that as we gather today, let's really discuss so that at the end we can contribute to the system, healthcare system, in a better way. When we have another pandemic, God forbid though, but we must, as insurance people, we must always plan for that worse and very bad situations, because that helps us to plan. So today we are again going to discuss all of this. Peradventure we have another COVID, we will all be prepared to tackle it. God bless all of us, and happy deliberation, and I hope that we'll be better at the end of it. Thank you very much for your attention.
A great big round of applause for our chairman and GMD, Mr. Eddie Efekoha. Would like to quickly acknowledge Dr. Lai Fatono, who has snuck in and is sitting at the back. A round of applause, please. And for Mrs. Odukale, who's also beside him, one of our, Bola Odukale, who's also one of our directors. Thank you very much for the welcome speech. Would also like to get a quick word from Dr. Adedamola Dada, who is the Chief Medical Director of the Federal Medical Center at Ebute Metta, who is ably representing the Minister of State for Health today here, Senator Mamora. Thank you very much, sir. A round of applause as he comes up, please.
Let me start by saying that I am not the Honorable Minister. My cap just resembles that of the Honorable Minister. The second thing I would like to say before I become the obedient civil servant is that quite a number of people are looking at me with my face mask. In fact, when we went for the cocktail, there was a young man that was intently looking at me, wondering if I was planning to drink through the face mask. And we must realize that we are the Federal Ministry of Health. We have not declared victory over COVID yet, and we must lead by example. I'm worried to note that nobody except myself and my Director of Corporate Service is putting on the mask. Yes, it appears that the guests of Hallmark Hmo have declared victory over COVID. And I say, so be it in Jesus' mighty name. Okay, so as has been rightly said, I'm representing the Honorable Minister of State for Health, Dr. Senator Olorunimbe Adeleke Mamora. I am an obedient civil servant, and he has sent his speech, which I would read without adding or removing anything. So, and it says protocol. It's my pleasure to be invited to give this speech on strengthening of the health system to improve well-being in this stakeholders engagement meeting today in Lagos. Health system strengthening is more often described as improving the funding of health infrastructure tied to budgeting allocation as a fraction of the total budget of any nation. But let me say it goes beyond this, to include improving health policy and building blocks such as a healthy, vibrant workforce, strategic health information to citizens, and health information management system, health financing, and leadership and governance. One of the important components of this strengthening is to improve access to healthcare delivery system through robust social marketing and behavioral change communication. This is to ensure people imbibe the culture of accessing health facilities early in any disease condition for better outcome. People should be able to access the nearest primary health care center to get a determined minimum level of care. This would, over time, improve our health services. It will also enable the secondary and the tertiary healthcare systems to do what they are set up to do, which is to receive referred patients from the primary and secondary level. A robust private sector engagement, together with our national strategies for HIV and AIDS prevention, infectious diseases surveillance, prevention and control of maternal, neonatal, and child health interactions, and eradication of malaria, among others, are the numerous ways the federal government is moving to strengthen our healthcare ecosystem. Our goal in healthcare strengthening is to achieve universal healthcare coverage for our teeming population. Getting there inevitably requires some form of health insurance or the other. Currently, our national health insurance scheme is mandated at the federal level to carry out this task. I know that they have been working with the HMOs such as yours to achieve their mandate. It's gladdening that a lot of states have set up their own health insurance scheme to complement ours at the federal level towards achieving the universal health coverage for all Nigerians. This partnership between the NHRS and the various community-based health intervention schemes will ensure equitable access to quality healthcare services for all, irrespective of their financial status, thereby improving the well-being of the vast majority of our population. We recognize some of the inefficiencies and inequalities in our health system. Some of these are: one, the skewed health resource allocation in favor of secondary and tertiary health institutions against the primary health care. Two, the cost of care in secondary and tertiary levels are higher than what the average Nigerian can afford. And then three, distribution of healthcare workforce is also skewed in favor of the secondary and tertiary facilities, located mainly in urban centers and out of reach of our rural population, where over 60% of our people reside. Because the absence of social security for vulnerable groups, inadequate public funding, because of our security and other pressing national problems, and the inadequate coordination between the three tiers of government on health issues. Let me assure you that the federal government is acutely aware of this, and measures have been put in place to mitigate inefficiencies and iniquities. I would like to conclude by saying that our nation faces challenges that delay progress towards the attainment of the federal government's goal of universal health coverage, some of which has been enumerated. On the system level, there are wide inequities resulting from lack of financial protection for the health needs and therefore the well-being of our citizens. I would say that encouraging the state and local government, which are semi-autonomous federating units, to set up and manage their own health insurance schemes present an enormous opportunity for rapidly scaling up health insurance coverage for all Nigerians. Although our federal structure, which prescribes a sharing of responsibilities on health issues among the three tiers of government, may seem as if health is everybody's business, and so therefore nobody's business, we can otherwise leverage on these predicaments by pooling resources and supporting one another to achieve the much coveted goal of UHC at the earliest possible time for the benefit and well-being of our people. In this process or journey towards achieving universal health coverage, HMOs have a great role to play. My prayer is that you pray it well for the benefit of all of us. Once again, let me appreciate you for inviting me to share these few thoughts with you, as I wish you well and God's guidance in your deliberation. Thank you very much. So you permit me, I will put on the mask again. Thank you very much.
Another round of applause for Dr. Dada, ably representing the Minister of State for Health, Senator Mamora. Before Dr. Adedamola Dada leaves the stage, we would like to invite Dr. Lai Fatano, board member of Consolidated Hallmark Insurance, to present a plaque to Dr. Adedamola Dada on behalf of Senator Mamora, the Minister of State for Health. A round of applause, please.
He has graciously complied. I think you can.
I can be like you. Yes. All right. Thank you. Distinguished ladies and gentlemen, they say when you are in Rome, you do like the Romans. Thank you very much for showing exemplary leadership. I was still telling people in the office this afternoon that nobody has told us COVID is gone. We are only assuming. So when I saw you, wearing your mask, I was telling Eddie, I need to show that many of us very compliant. Thank you very much for for accepting this invitation. And indeed, when I saw you, I wasn't looking at your face, but I was looking at your cap. So I know this is the Honorable Minister of State standing. So on behalf of Hallmark Hmo, I like to present this on behalf of the board to the Honorable Minister of State, and we just hope that you will be kind enough to deliver this to him. Thank you very much.
Thank you very much. On behalf of the Honorable Minister of State, I want to express our gratitude for the plaque, and I can assure you that I'm an obedient civil servant. So I will deliver this to him at the earliest opportunity. Thank you very much.
Another round of applause for Dr. Adedamola Dada, ably representing the Minister of State for Health, and also for Dr. Lai Fatano for that impromptu act of service. Thank you so much. So before we go to the panel session, we have a few quick questions that we want to ask, just to act as an energizer and maybe a little bit of a reminder as to the state of some of the factors that we are trying to work around in the Nigerian healthcare sector. I have a few questions. They are gifts, so they are gifts for the people that get the questions right. So the first question is, approximately what percentage of Nigerians pay for healthcare out of pocket? There are some HMO people here. I don't even know if that's a fair question to ask. Approximately what percentage of Nigerians pay for healthcare out of pocket? I think I can officially disqualify you from answering that question. In fact, you will tell me where you work before you answer this question. I don't know. It's almost like expo question. There should be another mic. No, you people will tell me where you work before. Thank you. You people will tell me where you work before I allow you to answer. All of you are cheating. Yes, ma'am. Your name and where you work, please?
Good evening, everybody. My name is Ibiduni Ladejobi, and I work with AA Rescue, a client of...
AA Rescue. Okay, yes. You're allowed to answer.
I would say 80%.
Okay, thank you very much. A round of applause for her. The lady in blue. Your name and where you work, please?
My name is Kewe. I work with Resource Intermediaries Limited.
Okay.
Okay, I'm trying to guess because I know the last time I checked about between 76 and 77.
Okay, yes, thank you very much,
you.
Kerry. A round of applause. The lady at the back. I'm suspicious of you. The way you are doing, I'm suspicious of you. Are you not a doctor?
I'm not a doctor. Okay, I'm Temitayo Ayetoto. It's 77%.
Why do you work?
I'm a writer.
Writer of what?
A writer of health issues.
Collect my microphone back. You want to answer? Your name and where you work?
Hi everyone. My name is Olawumi. I work for I work for GSK Consulting. I think approximately 75%.
Okay, awesome. Thank you very much. I don't know who we give because it's one person that got the exact number. It's 77%. So it's you. So 80% approximately on paper is 7%. So you get your gift. I will ask you another question. You are looking sad. That's what I didn't call you. You are looking sad. It's a gift pack. It's a gift pack from Hallmark Hmo. You know, it's not really what the gift is. Just the simple fact. The psychology is when you know that there's something to get. People are gingered. Of course, you can answer more questions, but whether I will give you more gifts to say is another thing. What's the per capita allocation for healthcare in 2022? I want to see the always here. No, leave your phone, leave your phone, leave your phone. What is the per capita allocation for healthcare in 2022? Round number. Round number. I don't want 1,782. No, round number. All the people that answered before, you are pressing phone. I'm seeing you people. Yes, please, please. Your gift, Karen. Thank you so much. Round of applause for Karen. Per capita allocation, you should know the answer. I should use the mic.
The equivalent of about $1 per person, $5 per person.
Because you see, when you say dollar, when you say dollar, it's not as if I don't know math. But when you say dollar, you now be wondering which rate are we using today? You understand? So, if you can give us in naira, please, sir.
400 to 1, CBN rate. Come and catch me.
416, $5, so that's 2,800. Round number. But it's not correct. It's not correct. If you want to talk, use check. Oh yeah, okay. 3,453.
It's about 3,450, 3,005 round number. As Nigerians, we need to, make it a round figure. So I win.
I think we have enough gift for the two of them. Next, I didn't get your name though. Sorry, can we get her name?
Florence.
Florence, where do you work?
AA Rescue.
AA Rescue. This AA Rescue. Is it more than car you people are collecting? You people know all the book yet. Yes, ma'am, your name and where you work.
Oh, my name is Dr. Kelechi Okoro. I work for Health Athena Consult and I'm the founder for Heal Africa Initiative.
Round of applause, please. Dr. Kelechi is also going to be moderating our panel session. Okay, so the last question. So both of them get gifts. No man has one gift. And I'm all for gender parity.
Thank you.
Converse and concave gender parity. Okay, so this one looks like everybody here will know it. But this question is only available to men. A man must win something. No. 3 women have won. 3 women have won. Let us balance it. When we leave all the men behind, who will we meet in front? What percentage was committed to health in the budget in the Abuja Declaration? Anybody that does policy work here should know this. Abuja Declaration, there's a minimum budget that was stated for health. It hasn't been met. So what was that percentage? No policy people here. Okay. If you are not a man, I'm looking at you. If you are not a man, put your hand down. I want a man to win so that when we are looking at the numbers, we will not say it's only women that came for our event.
So I thank you. You say it's not been met, so it's 15%.
Very good, very good. Clap for him. You see the way you use chest to answer. When you go to school and you know people. 15%. We're currently, okay, last question. Round number. For everybody, available to all genders present.
Thank you.
Where are we currently on budget allocation for health Everybody here must know that question. If not, just give me your resignation letter and be going outside. Where are we currently? Budget allocation for health 2022 budgets percentage. Round number, or don't come and give me. You have been looking for how to collect my gifts since. Or your answer?
About 29.37%.
Thank you so much. No. We have not met 15%, so that means ceteris paribus, we are less than 15%. We are much less than 15%. Does everybody else want to get?
6. 5.
Where are we? I want somebody that knows for shizzle, for certain.
6.
Approximately 6.
Yes.
I think we're closer to 4. If I'm not mistaken. It's 4.2. If I'm not mistaken. 4.2 as a 2022 budget. So the point of this question and answer session is that, in addition to the fact I want to confirm to you people that even though I'm not a doctor, me too I know book, and Google is my best friend. I also wanted to we wanted to highlight that there are a lot of challenges in the healthcare sector that we all know, which also translates to a lot of opportunities. The space between what exists now and what is required is very massive. And each stakeholder within the sector cannot achieve it by themselves. What we need to be able to exponentially drive growth in the space is an integrated healthcare system. And that's what's going to help us to be able to move from point A to point B in the quickest possible time, including, as Dr. Ajidamola Dada said, collaboration of private and public stakeholders. So that being said, ladies and gentlemen, please give yourself a wonderful round of applause as we move swiftly to our panel session, which is going to be moderated by the delectable Dr. Kelechi Okoro of Healthena. Look at that, of Healthena. And we're going to be calling the other present panelists who are here to please join Dr. Kelechi. Dr. Kelechi, please, would you like to escort Dr. Kelechi? Can we have some music as people are coming up? Can we have some music? No, I want her to come up with music. Okay, let's do escort. What kind of music is this?
Escort. Another person. 2 males, please.
Wow.
Another male, please.
Wow.
You.
Wow.
Thank you.
They say you should shift. Please give us
Sorry.
Give us something. Let's go. Coming like flower girl in front.
If you want quality health, maintenance.
So when you reach up, you dance, you give us small dance. Yeah, small dance.
I'm not trying to really work out, but that's the latest dance.
They don't know that.
Really? Okay, just mention one dance.
One-legged.
Oh my goodness! You have the music, one-legged. Even the DJ don't know.
Where is the problem from? Is it from Nigeria or from Lagos or from Hallmark?
It's the weather.
Okay, sing one leg and another.
Who knows the weather?
One leg.
Oh yes, sweetheart. One-legged. Show it one-legged.
Call on stage Mr. Soji Oyawe of Resource Intermediaries Limited. today or tomorrow? No. You can't go. Me, I will personally hold you here. You can go up. Then you do a small step. Yes, Hey.
If you want
one leg. You two give us one leg.
Hallmark Hmo, your health is our priority.
Since Dr. Yetunde, I know she's here.
It's right.
Okay, please fine. Once to walk. No, please, once the music on first before you come. Okay, yes. You have reached here now. This is what Dr. Yetunde Oyalowo. Some stepping. No, you can't rush and sit down. You can't rush and sit down. You can't rush and sit down.
Love me or you make me, know me. I'm messing me,
So Dr. Yetunde was running from me there. She now went and met Dr. Okoro, who is worse than me. So okay, so we have Dr. Leke Oshuni, Chairman Pinkan. Come on. Round of applause. And on that note, over to you, Dr. Kelechi.
Hello, everyone. Is my voice not sweet enough? Is it right? Okay, so I will go right into the panelist session. If you check this book, there's just Dr. Kelechi Louis Okoro as the moderator. I'll just go ahead and talk about the panelists, and then maybe later I'll tell you about me. So I'm very gender biased. So Dr. Yetunde Oyalowo. She's actually my mentor. She's been my mentor for years. Yes, and I'm happy I'm sharing the same stage with her to growth, right? And a privilege to be on this stage with you, ma'am. She's a Cartier Woman Initiative Fellow 2021 with a career of over 17 years, spanning various healthcare administrative management positions. She is the CEO of Market Doctors. A round of applause, please, not easy. A social enterprise poised to change the face of healthcare delivery in Nigeria and Africa at large. She's also a senior partner at Preventive Health Managers, a health management consulting firm providing support for employee health and wellness program for corporate organizations. Both companies are founded by her also. She has pioneered many health programs, including school health clubs in over 10 schools. She's the convener of Doctors Discuss Malaria, an annual World Malaria Day event that has trained over 1,200 medical doctors on current management of malaria. You can read through because of time, but I would like to share that she's her Network Woman of the Year award. She's gotten that award for healthcare. Fidelity Bank Most Innovative Business Award. If you're not jealous, please, a round of applause for her. AGPM Most Innovative Healthcare Business Award. And she's happily married with 2 kids. You're welcome, Doctor. You're welcome, Chief. That's how we say it. Yeah. Okay, next. Who do we go next? Dr. Leke or Mr. Soji? Sorry, I'm not going to say just Soji. Okay, I'll go with you then. Olusoji is a graduate of economics who also holds a postgraduate diploma at a master's degree in business management. His career spans 35 years with 19 spent in banking, plenty money, and most recent 16 years as an entrepreneur running Resource Intermediaries Limited, which he part owns as MD CEO. He is also an associate certified outsourcing professional, a fellow of Association of Outsourcing Professionals of Nigeria, a member of the Institute of Directors of Nigeria, and non-executive director in 3 other companies, and the chairman of a microfinance bank. Please, if you need money and you want money before you leave in here, clap for this man, take a picture with him, and make sure you don't let him go. Sakma is in town. Okay, so outside professional pursuit, he's a conference speaker, a certified member of the John Maxwell team, amongst others, and he is finding one's purpose in life. He's into finding one's purpose in life, leadership, personal branding, relationships, and a lot more. So if you've been served breakfast anytime in the past, before Valentine or before Salah, please, he's the man for you. So a round of applause for him. Okay, so Dr. Leke Oshini, please, hope you are not going to give me any punishment duty or I won't get into trouble. You're thinking about it. I'm sorry, please. Dr. Leke Oshini is a former Mobile scholar, a seasoned private medical practitioner. They're the ones that have all the money in the health sector. Do we agree? FMC. Do we have people in public service here? Civil service? Okay. See, they are working hard. And the private doctor people are the ones collecting the money and wearing fine clothes and doing final sessions. You see? I was right. Please share the money. Okay, eventually. He is a former National Secretary General of the Association of General and Private Medical Practitioners of Nigeria, current Chairman of the Health and Managed Care Association of Nigeria, an umbrella body of Nigerian Health Management Organization, all the sweet parts of medicine. He's in charge. So a round of applause for him. Okay, so is there anything you want to say first? You heard when the speaker spoke. We just want you to give just some cover statements and then we'll go right into the questions. Oh, please, a round of, no, hold on. She came late, so she has to stand up and give the audience a round of applause. She has to stand, everybody sit. Do you want her to stop? We're fine, right? Okay. Okay, so the young woman who just walked in. You're still a young woman because you don't look your age. You never look your age. Dr. Ola Brown, another mentor of mine. She's the founder of Flying Doctors. She's an entrepreneur and investor that runs the Flying Doctors Healthcare Investment Company, which is focused on investing in early stage companies in the health tech and fintech space, as well as healthcare infrastructure. The value of companies in their technology portfolio is $450 million. Now that you have said so, before you leave here, you know what to do. She's currently raising her 4th venture capital fund, as well as developing a pipeline of healthcare infrastructure projects worth over $200 million. She holds a bachelor's degree in medicine and surgery and a master's in economics and finance. Please, a round of applause for her. Not so loud because she came late. Please, a round of applause for her. Thank you. Okay. You're about to go. Yeah, just a cover statement before we go in.
Well, it's a privilege to be here. I'm from the private sector. I use health insurance more by obligation because of the work that I do. I'm required to provide health insurance for various staff managed for different organizations. If I had my way, I'm not likely to take health insurance. So when I was invited to speak here, I welcome the opportunity. And reason basically is for the private sector, especially businesses that are driven principally by profit, you need to convince me that it actually enhances my profit down the line. And
Exactly.
A lot of the practitioners in health insurance currently don't do that well at all.
Okay, so it's very good to have you here. You're not yet in the system, and you want to be convinced that you should.
I'm in the system.
No, you're in the
By
system.
obligation.
Exactly. So now you have to be convinced. Why am I supposed to continue doing this? And also, be a herald and convince other people to do so. Okay, round of applause for him, please. Who else wants to go? Dr. Yetunde.
So good afternoon, everybody. And thank you, Hallmark Hmo, for this. I would like to say good afternoon to my senior colleagues, to Mr. Tosin Awoshika. I have to say hello to everybody who has made me what I am today, because this just didn't happen. It's a process, and I'm happy that we're here to have frank discussions about health insurance, the health space, and especially being that I've worked in the health insurance industry before, and the work I do was propelled by the gaps that I saw in the health insurance space. So I'm happy to be here, and welcome to other panelists, Dr. Ola, Dr. Shimori, and Soji Iyawe. Thank you very much.
Yeah, you're welcome. Please, a round of applause. Yes, you can go, Doctor.
Mr. Yahweh, it is my duty and privilege as the chairman of the Chambers of Nigeria to convince you. If I do not succeed in doing that, I'll be remiss in my duty. We have sitting here with us Dr. Zamba, who is the lead of health insurance in Lagos State, which is the regulator. A round of applause for her. And beside her is our right-hand man, our consultant, sitting at her right hand, Mr. Tosin Awoshika, a very experienced HMO person. He probably was your client. You let him down. But I love it that we started with numbers. Most often when people are talking about healthcare, nobody wants to talk about the sums. Everybody wants to talk about that doctor didn't do well. Maybe the doctor hasn't been paid for 2 months, or maybe he doesn't have the equipment. So let's just go through some of the statistics, the health statistics. The average premium for an HMO client in the United States of America is $10,000 per annum. The average HMO pays $10,000 per annum. In Nigeria, the figure has now dropped to about maybe $60 per annum. So if you look at that disparity, it's more than 100-fold. Meanwhile, you expect the same level of service. We use the same kind of equipment. The medication is, the same. Doctors who live here to go there, perform just as well as the doctors there. So it's not a quality issue. So quite clearly, health in Nigeria is underfunded. And I usually don't use Naira for health statistics because the Naira is moving so fast. But the last time the Naira was stable in 2019, the budget of the Federal Republic of Nigeria was 360 billion Naira for health at the federal level, which was then $1 billion exactly. Now, of that $1 billion, $800 million was recurrent expenditure, leaving $200 million for 200 million people, $1 per person. Now, if you compare that figure with the United Kingdom, where there's 60 million people, 100% literacy, no malaria, very little TB, no snakes, no scorpions, no mosquitoes. They budget 120 billion pounds for the NHS per annum. 120 billion pounds is about $150 billion. Right, for 60 million people. So you can see that we're not even starting, and this may be one of the reasons why you have not achieved satisfaction. But if we step aside, I can tell you about a few ways in which you can achieve the satisfaction you want. Right? The war is not lost. Thank you very much.
Please, a round of applause. I think you both need an appointment to have that conversation.
Actually, I threw that in. Like I said, my principal day job is marketing. All those statistics you mentioned do not say anything to me. The value has to be determined by the user. So I'm speaking from the other side to health insurance practitioners. I'll tell you what you need to do. That's why I'm here today. From the user's side. It's not those statistics. Because until we see the value, like I said, when I say by compulsion, I'm insured. I mean, that's part of why I'm here. Hallmark is one of my principal. I have 10,000 staff and they're all on health insurance. So it's not like I'm not graded, but I know how it should be done from a marketer's perspective. Right? So that if you, it's insurance. So insurance is volume driven. So the more people you have subscribed, the price will come down. So there are things that needs to be done, and some of it, I have some suggestions to share. So it's not that I don't appreciate or understand it, but the private sector needs to be approached perhaps in a different manner from the way we seem to have done it so far. That's the suggestion I'm trying to put on the table.
I totally agree. And I know Mrs. Dotto Adeogun is taking notes. You're taking notes. And then you're going to make that meeting happen and make sure that he is sold, right? Okay. Sold and bought. All right. So we have Dr. Ola Brown to say her opening words, and then we can continue.
Good afternoon, evening, everybody. Sorry I came late. I actually came at 3 o'clock on the dot, but it hadn't started, so I left, went to another meeting, and then came back. But it's lovely to be here to discuss a topic that's always been close to my heart. And I'm not a health insurer, but we work with a lot of health insurance companies, both within the country and internationally. And I'm also not a practicing medical doctor anymore. I haven't touched a patient in nearly a decade now. So I did my master's in finance and economic policy. I'm currently trying to enroll on my PhD, which is in economics as well, so as far away from medicine as you can get. And I work in between healthcare and finance, doing healthcare finance for venture capital startups, technology startups, and also infrastructure. So I think it was an interesting mix from the HMO sector, from marketing, and from finance. And I think it's going to be a really interesting discussion.
Please, a round of applause for her. Okay, so Dr. Yetunde, I want you to be as plain and as blunt as possible. What do you think, what do you really think about the Nigerian health system? And do you think that we are at risk of excluding the poor in our present health system? But first of all, what do you think? Forget about, the Ministry of Health, they are not here, and the rest of them, right? So just tell us exactly what you think.
So
yeah,
I was I mean, when I asked that question, I said, if the Honorable Minister for State will be here, I don't know what I'm going to say. Because my frank answer was, is there really a health system? You know, that's the first thing. Then, yes, there's a health system. There's something in place. But are there gaps in the health system? And when I listened to the speech of the Minister for State, I found that it was actually very fair in judging the system. And, you know, he said, oh, these are the problems. We recognize that there are problems in the system. You know, so we know there are problems in the system. But the question is, are we taking steps to really solve these problems? And I think that answer is no. Are we taking steps? Starting from how much we are budgeting for health, starting the problems Mr. Sojoya is having, because I mean the private sector makes up, a higher percentage of people who use the health insurance, and we are barely even scratching the ground by the number of people that are enrolled. Then the sector I work in, informal sector, they don't even want to hear insurance at all. It's like preparing for something that you don't even know will come, where you don't have food, you don't have shelter, you know, that is even out of the way. So is our health system putting these things in place, considering that up to 70% of the people actually belong to the informal sector, and they are not even in this pool? And I want to also say that I think Dr. Zamba is also here, and I've gone to study Lagos State Health Scheme a lot, because I expected that when that kind of scheme comes up, then I mean, there will be some solace for the people in the informal sector. I know things are still work in progress. I follow her very well. I mean, she had a presentation last week. I was all at the presentation, listening and taking notes. I've worked with her firm for some things, and so I follow it very well. And you know, I think Lagos State is a model state, and if we get it right in Lagos State, we can take it over to all the other states. So the health, yes, there's a health system, but it's not working, and we know it's not working. And one thing I want to add, one thing I want to also add is that it's as if in Nigeria there's nothing like a right to health. There's nothing like a right to health, which I'll still talk about, than the problem of informal payments. Those are the two basic things I would like to talk about, maybe later on in the discussion. Thank you.
The person that person don't chop food, right? They do health insurance. That's exactly what she's saying. We don't have light, we don't have food, we cannot even access good roads. Then why would I want to put my money into health insurance, right? So those are the issues. Those are the issues we have. So Dr. Leke, so what is working? Do you think that there's something working? And if yes, what is working in the Nigerian health systems, and what's the impact on universal health coverage?
Dr. Okoro, do you pay tax?
Yes, I do.
How much did you pay last time?
I was taken from source, but I didn't bother to know how much is being taken. But every month, something, they just take more than they should take, and just know that money is going out. And some doctor associations are also taking from source, and then you just see your salary. You go say, wait, until I price the price. I've been they don't use my. Do you understand? So I pay tax.
So you pay tax. Okay, so yeah. So Nigeria is not generally known as a nation of taxpayers. We are tax avoiders. I don't want to say we are tax evaders because that's a criminal offense. No, we're tax avoiders. Most health systems that are government run globally are run off tax, and our tax collection is currently about 6% of GDP. GDP is in the region of, is also another moving target, but it's in the region of 350 billion right now. So 6% of GDP is 6 times 3.5 is about maybe about 20 billion US dollars. But the problem is that that tax is not enough, because most advanced countries have between 30 and 40% tax collection compared to GDP. We're at the same level as Syria, Ukraine, wartime Ukraine, Afghanistan, and so on. We're not paying tax. So we have to look for another way to finance healthcare, and that's why there are HMOs. In the United Kingdom, you barely see an HMO because the government provides the NHS. In 1996, during the Summer Olympics, I happened to be in the United Kingdom in a small village in Northern Ireland called Craigavon. And I was greatly inspired by the race that Michael Johnson ran. I broke the record in 400 meters. So I decided to go and run around the track. Unfortunately, there was a hole, so I stepped in the hole and I had a very, very bad fall. So I was taken across the road to the hospital, Craigavon Hospital, the village hospital. What I found in the hospital astounded me. It was better than any hospital in Nigeria. And I was told that in the British Isles, there are over 500 of such hospitals of that standard or better. So I realized that we hadn't even started the journey. Earlier on, we heard that more than 77% of healthcare in Nigeria is actually from the private sector. It's delivered by the private sector. So since the government is not carrying the private sector fully along yet, they can't. The system is evolving. Our hope, our very, very great hope, is with Lagos State. We're hoping that we will be able to combine the efficacy of the private sector with the might of government, starting from Lagos State and going across the entire country to roll out a universal health coverage type of system. So it's very important that the Lagos State scheme works, and I enjoin you all to please support Ilera Eco in Lagos State so that we can have UHC starting from Lagos and spreading nationwide. Rest.
Okay, thank you very much. Okay, Dr. Brown, what do you think can be done with respect to HMOs, educating the public about the importance of HMOs, and financing healthcare systems in Nigeria? And what role do you think your sector can play, since you're run far away from the patients?
So healthcare financing is definitely the biggest problem that we face in Nigeria, because Nigeria is a poor country. A lot of the so-called money that comes from oil, really, if we're 5 million or 10 million, then, you know, it would be enough to give us a GDP per capita that would pay for everybody's healthcare. But at 200 million, you know, we have a huge population and the country doesn't make enough money to serve that population. The GDP per capita is the amount of money, the total amount of money Nigeria makes, or any country makes, divided by the number of people. And that's how you get how rich or poor a country is. So if you go to a country like Qatar, for instance, the per capita income is probably around $80,000. In Luxembourg, it's about $120,000 for each citizen. So if you divided the national cake in Luxembourg, you'd probably get about $120,000 per person. America doesn't do badly. If you divided their national cake, you'd probably get about $60 per person. The UK is actually poorer. If you divided their national cake, you would get about $40,000 per person. If you divide Nigeria's national cake, nobody has stolen any of the money. It's complete. And gave to each citizen, you get less than $2,000 each. So that's less than ₦1 million per year each. So everybody would end up with 100K per month. And that's not enough to pay for healthcare. So for the first problem is income. And if you want to be able to do something about healthcare in Nigeria, then we have to look at how we can bring income into the healthcare system. And there's a lot of ways we can do that. I'll start with the easiest. Can we increase the budget? So the recommended budget is about 10% of GDP. We are nowhere near there. So can we increase the budget? Let's look at that. Last year, I think our budget was about $30 billion. And 70% of that was spending on debt that we've already borrowed. So we have to spend, imagine if you received a salary and 70% of it was going to pay back money that you've already borrowed. So 70% of the total money in the budget is already out going to pay previous debt. So we're working with 30%. Probably about 80% is used to pay federal government salaries for about 1 million people. So what happens to the remaining 199 million people? We have to share the remaining after debt servicing and salaries have been taken away. And if you've been reading the newspaper, this year we borrowed more. And we borrowed it not at 1% or not at 2% like a lot of countries do. We borrowed it at close to 8%. So there's banks in Nigeria. Zenith Bank is borrowing money at like 6%. Nigeria is borrowing money at higher than our corporates. So the market is obviously saying, you know, we're getting scared that you're not going to be able to pay back, so we're charging you higher interest rates for that risk. So we've got to look at ways of alternative financing for healthcare. One of the things that we're working on at the NESG, because I also head the private healthcare sector, healthcare group at the NESG, Nigerian Economic Summit Group, is looking at sin taxes. And we've already started that process. So taxes on sugar, taxes on unhealthy foods, taxes on alcohol, taxes on nightclubs, taxes on cigarettes. All these things actually cause health problems. We can tax more heavily and get some money into the healthcare system and make sure that it's a ring-fenced amount that can't be used for anything else, that is probably managed by a private sector entity so that the money doesn't go missing. There's also airtime taxes where, as you talk, you can be taxed. And like Dr. Leke said, we have the worst tax to GDP ratio in the world. Actually, Afghanistan did a lot better than us. Afghanistan did 9% of GDP in taxes. We did 6% of GDP in taxes. So at the time Afghanistan was fighting with the most powerful country in the world, and was being run essentially by the Taliban, they still managed to collect more tax than Nigeria did. So we need to look at alternative ways to do that, and one is collecting tax via airtime as well. The third is actually charging for our skills. So instead of allowing our doctors to just leave, we could actually make deals with the UK and the US and say, okay, we will actually, since you are so keen on taking our doctors anyway, let's come to an agreement, a diplomatic agreement where we actually supply you a certain level of number of doctors, and for each doctor, you pay us a certain amount per year. And Cuba does this quite successfully. They make about $9 billion. No, sorry, not Cuba. Cuba makes about $16 billion per year from this. Now, bearing in mind that Nigeria's take from oil and gas is just $9 billion, Cuba, a country of what, 5 million people, is able to make more than double than we do from oil and gas. So when people say that our real wealth is in our people, not offshore or in the ground, then we could be making money from skills exports as well and using that to fund the healthcare system. There's also ways, what I do across Africa is we actually fund healthcare projects, and we can fund up to $200 million to put into a project on a public-private partnership basis. So the government doesn't have to take on the capex cost of all of these projects, so they can manage their expenses a bit better. So PPPs are also a big way to finance the healthcare system. And then the banks. The banks seem to be the only people making real money in this country. So it has been suggested over and over again that the healthcare sector takes 1% of profit after tax from the banks, who continue to make money regardless of the economy. Some of them will be hitting 250 billion in profit. So if they're making that much profit, then 1% of PAT or 0.5% of PAT could be put into the healthcare system, and that way provide coverage for the poorest people in Nigeria as well. These are just some of loads of ideas that exist to be able to bring, or a mix of these ideas, to bring more money, crowding financing into the healthcare system and improve the healthcare system for everybody.
Please, a round of applause. I really wish that the Ministry of Health were still here. They are the ones who need to hear all of this, right? Most of it. They know.
I actually disagree. I think that everybody should hear this.
No. Everybody's here.
Because if you look at the UK and the US, the reason why the government actually prioritizes healthcare is not because the government wants to prioritize healthcare. It's because if you don't fund the NHS, then you'll lose the election. But if you look at the top 9 reasons that Nigerians vote, healthcare is not on that list. It's like food, first of all, and something else. Like, you see all kinds of reasons before healthcare and education. So no politician, politicians only have 2 priorities. 1, getting into power. 2, staying in power. Anything that is third is very, very low on their list. So unless it affects them getting into power or staying in power, then they're not going to execute. But if you hear the noise that Americans make, the whole election, the number 1 issue in America that Americans vote on is healthcare. The number 1 issue that the UK votes on is healthcare. So if you're not talking about healthcare, then you don't want to win.
Yeah, great point. And it means that we that are outside the government, we need to put pressure on the government, right? So it's left to us, everybody here, to relay this message back home. And when we start asking, when we're on social media asking aspirants, what are you going to do for us? Don't ask, let's just scream healthcare, right? Are we going to do that? If you're going to do that, just please a wave. All right, thank you. I'm going to ask everybody, I'm going to send a mail to everybody that is here today and remind you to ask your leaders to be accountable for, especially the healthcare sector, right? Okay, so thank you very much for that robust speech. Okay, Mr. Soji, you've been aching to talk. Okay, so what is there a role of, what is the role of HMO? Okay, no, that's not for you. Is there a role for private investors and business owners in strengthening our health systems? And how do we maximize these efforts? 2 questions.
Yes, thank you very much. There's actually a role for private sector involvement, and quite, it may not be that many, but quite a lot of organizations are already playing in that space, principally through their CSR initiatives. You look at Youth, for example, the dialysis center, the cancer center, and most recently, Airtel funded a whole word. Told it's called the Red Word.
Yeah.
So, I mean, for example, so you can tap into private sector using such initiatives. When I spoke earlier that for the private sector principally, by definition, is profit motivated, not owned and run by government. So whatever we need the private sector to do, you must come from that premise. And profit is not just revenue. A lot of people just look at profit as what comes in. You also make profit when you bring your costs down. So what I'll be doing by way of advocacy, like this event, right? There should be more and more of things like this. And I would suggest also for, yes, we should actually appreciate all markets. And going further, I'm sure you're familiar with the principle called co-opetition. Co-opetition, that is cooperating with your competitor.
Yeah.
So some of these initiatives cannot be driven by just Hallmark alone. You need to try and work with others within the health insurance community. I'm glad the chairman is here, for example, where you are cooperating with your competition. You could have an annual event, for example, where the focus is on health, and it goes for about a week, and you're looking for how to get the private sector to see that they make more money actually, because it's proven. I mean, I've been an entrepreneur for 16 years in this environment, for 10 years in Accra, Ghana, and it's proven that a happy, healthy staff is more productive and ultimately delivers more profit to your organization. So I will come from that premise. Like I said, I'm a marketer. So if you sit down with a typical CEO and MD and you're able to come up with models that demonstrate that you taking up health insurance, which may look costly, but what you want to do is present models that present health insurance as investments, not a cost. And it's possible, perspectives matter, right? Because the private sector just looks at profit. I mean, I said I have about 10,000 staff. Even at average 15,000 naira per staff per year, that's 150 million naira. How much profit am I making?
How much you're making?
Absolutely. Absolutely. So whatever statistic, GDP and all those PDP and all of those things, I'm a businessman. So you need to come from that premise. If you need me to buy it, I'm there. And practically in organization, for example, understand these things I've said. That when your staff are happy, healthy, they're more productive. We have a creche in the office. My staff resumed from maternity with the baby to the creche in the office. Right. We've moderated our closing times so that our staff can beat traffic to get home earlier. Wow. We have flexible work hours deliberately built in, so because we understand that these things, we don't see those costs as cost, we see them as investment. And it's showing, I'm seeing the result in the productivity of my people. So when I spoke earlier, I'm speaking from that perspective. I understand health insurance, but I'm saying when your sector comes to market us, you don't come that way. So if you want to get more and more private sector buying into health insurance, you have to come enter our head, and all we think of is profit. So it's either you're showing, so just move away from that 10,000. So you need to demonstrate, and I can see it, that 150 million, I'm actually saving 500 million. I can build those models for you. So it's your approach. Because once you do that, then you get more private sector buy-in, and then more and more would get into it. Look at, I think it's Access Bank that does the marathon. That is also an initiative in that direction. It's not just running. There's a fundamental health principle behind that. So I'd like to suggest it may be difficult for just one company. So consider co-opetition. It is a recent, about 2-3 years old business practice where you are cooperating with your competition. Look at the telcos. When they started some years back, everyone had their own masts. So on 2-3 about Within 10 meters square, you will see several masts. They have since moved away from that. Now they all share one mast and share the cost. So your sector needs to do more and more of things like that. That's how you get the private sector involvement, in my view.
Yeah, please, a round of applause for him. What he said is very right. Most of the time we approach, when we preach healthcare to people, we talk about it like it's charity. We talk about it like, I remember when I was sending proposals to government agencies or people who were going for elections, and then I bring a health proposal and they push it away because they are not seeing what is what is the political value. What is the political value? And so please, that's some very interesting point, and we need to approach healthcare and health delivery, health advocacy with more initiative. We have to be more innovative and think of profit. When people come to the hospital, they say they act like they're coming for, like somebody doesn't want to treat them because they don't have money. But those services have to be paid for. Okay, so please, we need to sell and buy these guys the right way. Okay, Hallmark Hmo and the rest of the health care sector here, please, let's do the right thing. Okay, a round of applause for Mr. Soji again. Okay, so these are the last rounds of questions so that we can take the questions from the crowd, yeah? Okay, so Dr. Yetunde, what are the practical steps needed to be taken in addition to those taken in the past to improve maternal health? Okay, just tie it in with every other thing we've talked about now and then make these other points we wanted to make earlier on.
Thank you. So okay. I will talk about just generally. I know maternal health is important, but everybody's health is actually important. And I will talk with regards to my constituency, that is the informal sector and the poor. Like we have all said, where poverty is, and Yorubas will say, "Ebi olewa loro ki nkan mi ko." Do you understand? So in a country where there is poverty, what do you really want to do with healthcare? And I would say health insurance is skewed towards equality and not equity. It's skewed towards equality and not equity, such that there are just plans. I mean, you just have to buy one of these plans, and if you can't buy one of these plans, then you can't have health insurance. But there are people. Let me use Loma. A street sweeper earns like 25,000, and the cheapest plan is 8,000 per year. The person is not going to leave that 8,000, you understand, for health insurance. We rather do other things and believe that it shall be well in Jesus' name. So it's skewed. So it's skewed towards that. So, but for equity, it means we have to design something that will favor everybody, meet people at their point of need. For some people, they're purchasing health insurance because of cancer care. So I want the highest insurance. I want to use the best hospitals, like all of us in here. They want to use the Evercare. They want to use the big hospitals, and they just want a plan for it. That is a set of people. There's some. The only thing they really need is, I have malaria, I have a cold, I want to have a baby, and let me just do that. Every other thing will sort out itself. So the plans has to be skewed towards equity, so that there's something for everybody. The second thing I would like to talk about is this informal payments. You see, especially when it comes to government and some of our plans too, we say, oh, you don't have to pay anything. No, you just get to the hospital, you're not going to pay anything. Government says, get to the health center, it's free. But we know that people get to the health center, it's never free. Go for antenatal, yes, delivery is free. When you get there, the first thing they tell you is that, you're going to do your blood sugar and this, so just bring 500 naira. There's no receipt for that when you do it. Then they tell you there is baby pack. Just bring this, you buy it. That one is not in the system at all. Then when is the day of delivery? This is the word they normally put you. But people that pay this is where they go. There are informal payments everywhere in the system. And even sometimes, even for those who are insured, they get to the hospital to get a bit of other benefits, there is a payment. So those are part of the things, we have to eliminate. Then the health system, like I said, yes, there's a health system, but how does it work? And if we want to achieve universal health coverage, we have to look at the primary healthcare system. And when I talk about primary healthcare system, we are now not talking of infrastructure. the government and a lot of us are into buildings, structures, equipment. But you see, in Nigeria, the real bulk of the people are not going to use those equipment. They don't need those buildings. What we need to invest in is people. It's really people. And when I go into people too, doctors, nurses, those of us in the health space, we need to demystify this health thing. It's not everything that a doctor has to do. It's not everything that a nurse has to do. There are a lot of tasks that we can share with other people, teach them how to do it. And they will do it, and they can send you what they get, and you can interpret, because those are the things that put pressure on the health system. We have to begin to mimic other systems that have done things in terms of community health worker, health agents, and all of that. And you know, you find that the healthcare can actually reach people, because when you're talking about healthcare, it is not accessible to people in terms of physical structure. That is a health center or a health post being accessible to people, maybe walking distance of 10-15 minutes. No matter the number of plans you want to sell, the person is not going to buy it because they can't reach it. If it's also not available, and when I mean availability, they get there, today there is drug and the stock is down, tomorrow you can't do the test, this is not around. If that is not available, it's not going to, I mean, the private sector will not find it good, and even those in the informal sector cannot even get into this system. When we also talk about the health system, we want it to be appropriate for the people. Health insurance is not yet appropriate for the people, and I'll give you an example. In a company where there's a cleaner, there's a gate man, then there's the junior staff, then there's the manager, and there's the senior staff. Then you bring plans, then they have to deduct the money from the salaries of people. The deductions, is it equitable? Do you understand? Because I'm on a health plan, and I know how much is deducted from the principal's salary. And for him, it may not mean anything. For some people, deducting 500 naira in a month means a lot when you look at the percentages. So that's what I mean by being appropriate for the people. Then also, where they get the health care from, is it appropriate? For some people, the white collar syndrome, some of the people in the informal sector, they won't even dare go near a hospital because they'll say, the kind of English they're speaking is like Dr. Ola's English. How will I even hear the doctor? The doctor is going to wear a white coat, all bottled up, and by the time you are entering, the doctor is writing your prescription. You know, so it has to also be appropriate. We should speak our language. I don't know why people in the hospital sometimes like to speak English, you know, and like to, but when the person, you can't even communicate, because when you ask the symptoms, if you don't hear it as in the real language the person understands, the person can't give you the description of what is wrong. So it has to be that appropriate. Then we also
like your body, they do you GBGB
because of my people, because they don't have access to healthcare. You know, and I'll just round up and also saying, of course, affordability is everything. Beneath all of this, affordability is everything. And if it's not affordable, what are the other means by which it can be done? And Dr. Ola, I like a point of discussion. But you know, what I'm just fearful about is that even when we get all these monies from all these different, who does it go to? You understand? Because even what we have, how has it been appropriated? You know, and there's so many innovations that are being killed. You know, and those of us in the innovation space, you even want to do something, it's so difficult. By the time you think of government regulation, you think of this, you think of that, you just decide, I'm not going ahead with this. So all of those things have to be appropriate if we are really going to get healthcare to the people. Of course, we know that there's not so much noise, but the politicians know that when you give classes in the community, at least they will remember your name. There are some classes that have names in the system, and we know. You know, when you do this in the, at least these people, they will remember you because they don't have, after they forget about you. So, you know, we have to look at it wholesomely. Most of what the people will sit down to talk about are not the big percentage when it comes to the health system. A lot of people that still really need the health system cannot get to it. Thank you.
Thank you very much. Thank you very much, Dr. Yetunde. She's talking about bespoke health packages for everybody so that it can reach everybody, not just the elites and also those people in Adugbo. and every other place that they need it. So now, Dr. Leke, last question, and then you can round up. So we can go for the question and answer session. What is the impact of government's efforts so far in strengthening this system, and what should they do better?
Okay, so the holy grail of healthcare systems globally is universal health coverage.
Yeah.
Right? Now, we have parts of this country where 80% of people earn less than $1 a day. And we have amongst the worst health statistics in the world. Nigeria contributes more to the health burden. For example, 20% of women who die in childbirth globally are Nigerians. It used to be 10 about 30 years ago. It's now moved up to 20%. So even though we are only 200 million people in a world that is almost 8 billion people, 1 in 5 women who die globally are Nigerian women. Now, those are horrendous statistics. And it's been estimated that if you want to provide universal health coverage for Nigerians, you would spend, and these figures are from the National Health Insurance Scheme, you would have to spend about 15,000 naira per person per annum, which comes to about 3 trillion naira. If we could find, the ES, the NHS says, if we could find 3 trillion naira for healthcare, we would be able to provide healthcare for the vulnerable. We call people who are unable to pay for healthcare, we call them the vulnerable groups. Lagos State is doing a lot in that sector. Thankfully, the example of Loma you quoted, everybody in Loma is actually covered. All workers in Lagos State are covered under the Lagos State scheme, and that's very commendable. What Lagos State is now looking for is how to pay for the vulnerable, and that's what, and that's the nationwide problem. There's a paper which was recently written. It's called the Lancet paper on Nigerian healthcare. I would recommend it to everyone here, and it gives a line by line, a pathway to achieving universal health coverage. But key is that 15,000 naira per person per annum, and that 3 trillion naira, which we hope we will get from, as Dr. Brown said, from sin taxes, from telecoms. Now, telecoms, if you look at the profit, the first quarter profit of MTN, which was released less than a week ago, you will see that quite a lot of money can come in if they charge. So they're thinking of charging, I think it's 1 naira per minute or 1 kobo per second. Hopefully, we'll be able to rake in maybe between 500 billion and 1 trillion naira from there. And then all these trader money things, we have to put it into healthcare than to put it into places where they will disappear. So
there's also a bill that you're going to tax. There's tax on soft drinks.
Taxes,
soft drinks.
Tobacco,
so
soft
if you
drinks.
insist on drinking unhealthy drinks, if you insist on smoking and all of that, you'll be funding the Nigerian healthcare system. Clap for yourself, please.
So, of course, there are a lot of people who are saying, why should all that money go to health?
Yes, because it's a health.
People in the system are saying, all that money for health, maybe those people, maybe God has destined them to die.
One thing must kill a man.
So there are all sorts of people lobbying for these things, and we hope we'll reach the destination.
Amen. It is well. A round of applause for Dr. Leke, please. Okay, last question. Still on the vulnerable groups, right? What are the how do we address the vulnerable groups with a sustainable health system, and who are those people responsible?
Okay, so first, on the subject of the vulnerable, I'd just like to highlight something about the industry, because whenever I come to HMO conferences, whenever I come to healthcare conferences, there's always, this idea that we're doing things wrong, and actually it's because doctors don't know about business, and you people are just not marketing well, and you're not selling it well, and look at people in other industries. The truth is that healthcare business is hard. Aliko Dangote raised $25 billion. It's Does he not know that he could put it into hospital business? So why did he go and put it in refinery if he knows that healthcare is good? He doesn't know how he's going to get profit out of the industry. That's why he didn't put it. He put it in something that was going to bring money, right? The truth is, I knew a doctor that worked for 25 years on his hospital, and he was a poor man. And people were telling him that same kind of advice. Oh, it's because you need to go to Harvard Business School to understand business. You need to do this. It's because you are not marketing well. Let me give you the strategy. I'm telling you, the day that guy got an oil block, the next week he became a billionaire. He didn't go to any business school in between. He just did an easier business. The truth is, if you like, bring Aliko Dangote, Jimovia, and Tony Elumile to go and run hospital. It's still the same profit that they will make. Because at the end of the day, you cannot open up 25 branches of Reddington on this island and they'll all be profitable. You can only do 25 branches of Zenith Bank. So the first thing is, it's hard. The second thing is, what have all these billionaires done that we have gotten wrong? I think that the answer is in advocacy. Somehow the government of Nigeria was convinced to put policy in place to make cement, to make it difficult to import cement. And we've ended up for the past 15 years buying the most expensive cement in the world to allow Nigeria to become self-sufficient in cement. Somehow somebody put it in the government's head to subsidize PMS. And we have minted billionaires. And we continue to mint billionaires every single month because somebody put it in the government's head that Nigerians like cheap fuel. So Ghanaians, Togolese that are poorer than us on a per capita basis actually pay more for fuel than we do. Fertilizer, heavily subsidized by the Nigerian government. Billionaires upon billionaires have been minted silently in that fertilizer industry. But somehow we've not managed to convince the government that Nigerians need cheap healthcare and cheap education. And actually, these are the cornerstones of any society. Economies have evolved without cheap PMS. Economies have evolved without being self-sufficient in cement. Economies have evolved without having cheap fertilizer. But no country has become developed without access to education and access to health. Check it, the NHS is the biggest employer, sixth biggest employer in the entire world. If you look at every single American state, the biggest employers are healthcare and education. So healthcare is not, like you said, a social thing. It's actually a major employer. It's a driver of economic growth. And why do you think all these people are going around doing banditry? It's not because they want to be criminals, it's because they are unemployed. So if you invest in something that creates massive employment, the NHS is the sixth biggest economy employer, not in the UK, in the entire world, then you see a situation where healthcare can solve all of Nigeria's problems, from our security to our economy to our unemployment. Thank you.
Okay, Mr. Soji, your last question. How do we maximize the use of social media to improve disease outcomes and attain why to him?
Because I live on social media.
Yes. Or you do your own marketing behind the scenes. You don't come to social media. You're not the one that does the social media thing. We should have an idea.
Well, the reality is anything social media is best driven through what you call social media influencers.
Like me.
Absolutely. Like Yonifa Sheo. Yeah. So that's the thing, because it all comes back to marketing, and that's what you want to achieve through social media. We all think we make logical purchases, but every purchase is emotional. Yeah. Nobody makes a logical. I'm sure you've all gotten back from some days and you're like, how did I buy this? Every purchase, almost every purchase, not almost every purchase is emotional. So what you want to do again is work with social media influencers and get their buy-in to sell either some of their advocacies or the success stories that are happening along all of these suggestions that they mentioned. And perhaps I'd like to appeal to us. You see, when situations are challenges as enormous as we seem to have, it can be quite frustrating. And there's sometimes a feeling of, are we really achieving anything? Right? But a lot is already being done. The results may not be that glaring. I go back to even a program like this. It's part of that process, as it is to sustain it and be more, again, a lot more effort and resources is required. And hammering on co-opetition. About 12 years ago, my business is 16 years old now, we're principally into human resource outsourcing. About 12 years ago, we had some similar challenge, and we started what we call an annual outsourcing expo, just to bring practitioners together to talk about the problems, because our sector is not even regulated. Everybody loses a job today, they create a card, then they see social outsourcing, and they get business, and it causes a lot of problems in the market. And we did it. We had 250 people in attendance, lots of providers in that space. By the second year, 2 other providers, ICSL and Big Lawrence, approached us that they want to part sponsor the second edition. And then by the third year, the Outsourcing Association of Nigeria approached us that they want to take over the annual event. It's run every year in the last 10 years, other than COVID, by the AOPN. So that is co-opetition. Right. We didn't say we started it, why should they buy into it, why should they? And it's grown a lot bigger. And rather than us looking for 5-10 million naira, you have 12-20 people putting down 40 million naira. So, and all of that also, the social media, you just need to work with influencers. And it's not difficult. And paid advertisement. I follow quite a lot of practitioners also online. The best person to sell you is not you. And unfortunately, most of us sell ourselves. So you put up banners, you put up programs on your handles, social media. No, that's not as effective as a user or somebody else. So if Yemi Fashion says something about you on your platform, it has a lot more traction than Hallmark saying health is this, health is that. What else would they say? It just looks like, so that's why. So you may need to also consult a few people. Unfortunately, people like us, you pay some money, but you'll get the results.
All right, thank you very much. It's a good thing that Hallmark Hmo has been using social media very well in the last how many years. So a round of applause for Hallmark Hmo. They can do better, but for now, I think they're the leading organization making use of social media. They had this Valentine event, the last Valentine, they had a program, a social media contest where people had to say something about Valentine and win a health package and also a healthy food pack from Hallmark Hmo. So so they are promoting good health, also promoting bonding, and also promoting their services, because they didn't come out to say come and buy plan or whatever. They said participate in this healthy challenge and then you win something. So people get to know about what Hallmark Hmo is doing. And then emotional buying, that's where it comes in. Hey, these people, they can actually do this for us, to talk to us about our health and help us win something. Let me find out what their services are and also, get them. So a round of applause for Hallmark Hmo. I wanted to say something.
The workers, they just went by. It was a fantastic opportunity for the kind of competition I'm talking about. Everybody was at home to have come up with whether some health talk or something you can do, or even approach as many of your clients or customers as possible. Those regular health tips, health checks, and some else are just opportunities as I'm speaking. Most organizations have the first aid box, right? But most are administered by people with no training whatsoever. So how about you coming up and just putting up some training for first aid, first whatever, free for various organizations. And that's a principle of marketing. You give free, but it's not exactly free. But I can bet you, if you do things like that, you'll be amazed at how many organizations will send a representative. Then you have a captive audience. And out of that, 10-20% will come back to buy from you. I'll send my invoice later.
All right. Thank you so much, my wonderful panelists. So just give us like 5 minutes so we could take just a few questions. Please make sure your question is relevant, and I'm sure everybody's like the first, one of the panel sessions I've anchored that everybody is actually not yet tired. Who's tired? Nobody, right? We're all listening aptly. Dr. Leke, you're shaking your head. You're not tired, right? No. Okay.
There's so much to give.
I know there's so much to give, but we don't have enough time. And that's where, talking about social media, we could actually continue this conversation online. So this panel session is just panel session A. We're going to do the B because there are a lot of things that we haven't said yet. So please, another session on social media. We'll have hashtags for it. Invite more people and we'll make it trend. Okay? Hallmark Hmo, do you agree with that? Because this is just like 100 people or 200 people. Social media, Fam Adebaki knows how we do it on social media. We go viral and then everybody's hearing about it, not just here. So please, your questions, take 1 or 2 questions and then we can wrap up. Who's helping us? There's someone at the back. 1 million female. For equity or equality, which of them? All, okay.
I have a question. How do we unlock the people at the bottom of the pyramid for health insurance?
Who are you directing the question to?
You can pass it.
Okay. Who wants to answer? Okay.
So I'll tell you about my experience with bottom of the pyramid, but not in Nigeria, actually. It was when I was going on my honeymoon in Los Angeles. And I got into the Uber, and normally, now I say that I'm a banker. I don't even identify with this, your profession. But accidentally, out of habit, I got into the Uber, and he asked me what I do. And I said, oh, I'm a doctor. That was how story started. He had to go to Mexico for his knee operation. He almost got shot, this one, that one. So I'm like, wait, first stop. We're in America. And you went to dangerous Mexico to go and have your operation when Stanford just built an orthopedic center of $1 billion just a few minutes away from here. And he said he couldn't afford it. And I said, wait, you're driving in an Uber, you're an American citizen. Tell me how much you're making from this Uber. And it was about $500, $600 a month, maybe, as I recall. So when we looked at the cost of health insurance, and we looked at how much he was taking home from Uber, he actually didn't have enough money to buy health insurance. And that is in America. And that's why every election, you hear the people on the left, the Democrats, advocating for Medicare for all. And don't forget, even in America, 1 in every 3 people is still paid for by federal government for healthcare. And that is the most capitalist place in the, on the face of the earth. So the bottom of the pyramid, the Medicaid and Medicare systems actually cover the people at the bottom of the pyramid, even in America that is capitalist. Come to Nigeria, the bottom of the pyramid, the definition of the bottom of the pyramid in America is anybody that earns under $24,000. If you earn $24,000 a year, you're a gem in a bank. You're a big boy, in fact, the biggest of boys. But there, it's actually the poverty level. So when you talk about the bottom of the pyramid in Nigeria, and remember, there's no country in the world that has more poor people than Nigeria. You're talking about probably about 60% of the population. And the answer, we found it for PMS. We found it for fertilizer. We found it for so many things, but we've not found it for healthcare, is actually finding a way to subsidize the cost of insurance through government. And America is probably going to end up doing it if the Democrats stay in power. The Republicans, if you can't afford it, then that means you're not working hard enough. That's what they'll tell you. And they don't have that healthcare for all mandate that the Democrats have. But if the left stays in power, then they will have to subsidize all of those people or find a way of incorporating all of those uninsured people into the Medicaid plan. And in the same way, this 15,000 per person that Dr. Leke talked about, for the bottom of the pyramid, there's no way out. The government has to subsidize it. And the government is already subsidizing a lot of things. I don't understand why we live in a country where we're subsidizing petrol, we're subsidizing power, we are subsidizing fertilizer, and we're not subsidizing it. Do you have to be alive to use all of those things?
Please, you round of applause for that. Okay, so let's get his question. Add whatever you want to add.
Okay, so I agree totally with Dr. Ola. But I mean, if we have to wait for the government, I don't know how long we're going to have to wait. But I mean, there's some small steps that can be taken to help, this category of people. So in the work I do with market doctors, initially when I started, I thought that, well, I don't want too much profit. I have other things I'm doing. I just want them to pay a bit, to do something for their health. But I found that really some cannot, and that's the truth. So before waiting for the government, you can actually, within the system, you can actually do that. Saying we're waiting for 1%, there are companies that have decided to dedicate part of their profits to healthcare. And work a lot with such companies who dedicate it to healthcare and allow the funds to be used to take care of people who really cannot afford healthcare. And that was why I said, when you want to dedicate such funds, when you dedicate it to infrastructure, it really doesn't do anything for them. But when you dedicate it to manpower, I mean, in a health center where there's no doctor, you put a doctor there, you make the nurses available, you make commodities available, then you've gone a step ahead. It may be difficult to do it all round, but it's possible. Then even within the healthcare space, I mean, there are, when you want to go out, charity should start from home. So I think HMOs make profit, hospitals make profit. In fact, a lot of hospitals outside the shores of Nigeria have foundations, and they, reinvest just a part of it, for people who cannot afford it. And we have some sort of those partnerships that when we find people who have a major problem and they can't treat it, we approach those hospitals and they give the health care to them for free. So we should also look at little steps that can be taken initially before we really get the government to do that. Thank you very much.
All right, thank you very much. Please, a round of applause for her to take the last question, please.
My name is Austin. I want to put the line of we are not doing the communication. Get the hospital. A doctor will rather treat you before telling you what to take you. It cannot educate you after what you say to you. In other times, they will sit you down, tell you what they're going to do, and procedures that will do for you. But Nigeria just gives the hospital, they will give you medicine on the day, but they don't want to give you medicine that you are taking. And you ask any doctor, he or she is going to work time to tell you that this is Panadol, this is this, that. You are taking it for time and now. So you have the right to know what you are taking. So in that area of communication, maybe that's why people are not open when it comes to going to the hospital. What can we do to address that?
Okay, please, can I answer your question and then we'll round up? Can I, because I'm a practicing medical doctor. Does any other person want to answer this? Who wants to? Okay, so when it comes to communication, I agree that in the hospitals, they don't do that, or they don't do as much as they should because of the constraints. One medical doctor is working for 24 hours before someone else comes to relieve the person. Sometimes they do 2 shifts. In Lagos, one medical doctor has 3 workplaces. They're working morning somewhere else, afternoon somewhere else, and then weekend calls somewhere else. So that doctor might not have the time to sit you down and tell you all what your problems are. Okay? No. I'm saying this is why it happens. The only way we can is what we'll be talking about here. The only way that can be controlled or we can intervene there is when we have more doctors, we have more time. Because a doctor has like 5 different places they are going to, and they, for example, for a private hospital, you can't expect to see one patient for like 5 hours. And some patients actually want to talk for 5 hours. Where I did my youth service, there, the treatment is free, everything is free. But when I'm talking too much, because I like to talk, I like to educate my patients. That's what I do online. I break down medical diseases and talk about it with no medical jargon and all of that. So I have time to do that. When I'm doing these things, the nurses, they'll come and be knocking that I'm wasting so much time on one patient.
Let me also add something to it. So she's not trying to make excuses for the doctors. She's just trying to say what happens. This is how it is. But I would also like to add that, some things are rooted in structure. The curriculum, the training, you understand, you've learned it over time. You trained in a public institution where on daily basis, hundreds of patients, 4 doctors, you run through it and all of that. So already you've imbibed it, that the patient comes in, and I've mentioned the patient comes in, you've looked at the patient, you know the likely thing that is about to happen. Until the patient says something that strikes you, then you stop and say, what did you say? You said you have a pain here, then you begin. So that is it. But when you work in a hospital that has a system, I mean, with the EMR now, there are some things you really have to tick out before you begin to write. So that system allows you to interact, with the patient. Then again, hospitals, in the health system, we need to have SOPs of how we relate with patients, so that whether you are seeing A, B, or C, there has to be a system which will allow you, give you the room to communicate, with the patient. I think if all of that are put into place, it would also help with communication with patients.
Again, speaking from a private sector and a user, fantastic question, but the reality on the ground is we want to expand coverage, health insurance coverage. So the person who is going to pay for that has an expectation. So regardless of the constraints of the doctor or the system. So when my staff gets to the hospital, I've assumed that the HMO that we have signed on to that chose that hospital for us has chosen the one that meets this requirement. So once we get there and my staff doesn't get that access, 2 things happen. Like I said, I'm an outsourced provider. When I say 10,000 staff, they are my staff deployed to various organizations. I only earn a fee per month per staff. So instantly they call the client, not me, that this company, you people have given business. They sent us to a hospital where this happens. Once I hear that repeatedly, I lose the client. So that's why I said I need to be convinced. So it's not that we don't want to pay. So when I spoke of advocacy earlier, it may not happen immediately. But thankfully, Hallmark has started this initiative. Have a long-term view. As Jeff Bezos, one of his key valuations for a successful business anyway, you must have a long-term view. So it's not something you are trying to break even this year or next year. I'm glad your board and chairman are here. There are those pressures there, but you must have a long-term view if you want to get it right. So if I was in your kind of business, gradually I would try to identify, maybe not everywhere first, in major parts of Lagos or in this state, which hospital meets those requirements. Even if I have to come up with some training for their staff. Because sometimes what you hear, by the time you read the doctor is even far. Sometimes they tell you right from the gate, sorry, we don't know your company, and we have paid an HMO who has told us to go to that hospital. Then you tell my staff that you don't even know us. And sometimes they tell us that the HMO has not paid them. I don't want to know that. These are the realities. So, like I said, we need to, this is a wonderful forum, wonderful opportunity, but you can own this space, Hallmark, because there's a big gap in this market. You can own this space. It will be slow, but if you get it right, from word of mouth, from the experiential, that's really what customer service is. What do I experience when I come in contact? So, and you then blacklist the hospitals that don't give you all of those things, and gradually you identify the right hospitals. You know, I know it's tough, and I get the point. Hospital business is tough, but it's still a business. So the only way you can grow is if I, the user, I determine the value, not whatever you tell me.
Please, a round of applause for all the panelists. You want to see?
I'd just like to add my voice, as a medical practitioner who also runs an HMO. A poll was done recently about how many doctors would like to travel abroad, to work abroad. I think it was almost 100%, including aged professors of medicine, my lecturers, fresh graduates, youth corpers are already doing the exams. Final year students are doing the exams to go out of the country. In the past 1 year, 5 of my doctors have left to the UK. So their minds are not even here. Their minds are not here. And the turnover of doctors in hospitals is colossal. They work for 3 months before they even learn the ropes, they've already gone.
It's in every industry now, sir. It is in every industry.
Yes, everybody.
I'm telling you.
Sorry, can I jump in there? There's no other industry that's only one exam that is relatively easily that is preventing you from traveling, and they're even inviting you. They're paying for your tickets. They have given you accommodation. They are coming to rent a hotel and taking doctors away from there. And don't forget that with medicine, it's the government that pays for that training.
I've lost staff like that.
No, the government pays for that training for 6 years. It's very different.
Can I say something? Mr. Soji, can I say something? Can we continue this conversation, this same tempo, this same heat on social media? Can we do that? Hallmark Hmo, can we do this every week? Social media conversations, and let this conversation shouldn't Twitter space. Yes, Twitter space. It shouldn't be just in this room. A lot of people need to add their voices, and we need to also hear that. In fact, we've said so many things, and I hope I can remember everything, because I have learned a lot, and I have heard so many problems, and I assure you there are more problems, and there are more contributions from people that are not in this space. So promise we're going to have this conversation again on social media, courtesy of Hallmark Hmo. We've had a lot, and I know we want to hear more. So a round of applause for yourselves and for the panelists as we take a picture together.
The incredible panel, please, a real round of applause, please. So keep coming for us while coming for them, taking their picture. This has been such an incredibly informative, educative, and entertaining panel. Another round of applause, please. On behalf of the management board, management staff board of Hallmark Hmo, would like to thank you all for such an impactful and incredible panel. It's not balanced though.
No.
It's not balanced though. Thank you. Yes, thank you. Always carrying book. Dr. Brown, we caught you too. Thank you so much. Would just like to give a token of our appreciation to all the panelists. We're going to be giving out plaques to thank you all. Please don't leave the stage after exchanging cards.
Those numbers are mine.
After exchanging cards, Mr. Ayawale, it's you that wants to talk to first because I don't want to see this problem.
100 million a month.
No, 15,000.
Hello, sir.
Yes.
No, please don't leave. Hello, sir. We're trying to give plaques. If you could stop giving your cards. Thank you.
I'm a marketer.
I see that. I see that. So I would like to thank the panelists. It's been such an impactful panel, as I hope you all gathered as well. The first plaque will be going to Mr. Sojiro Yawoye of Resource Intermediaries, ILR, and it will be handed by Abimbola Adebaki, founder of Advantage Health, and also a member of the board of Hallmark Hmo. A round of applause, please.
Hello, how are you? Okay, so you know. Can I sit now?
We're going to, thank you so much. Thank you so much. We're going to ask Mrs. Yetunde Lori, DG Nigeria Insurance Association, if she's here. Round of applause, please. She's going to be assisting us to hand plaque to, she should go up. She's going to be assisting us to hand the plaque to Dr. Yetunde Oyalowo. So that's from one Yetunde to the other. Thank you so much. Thank you so much. We're going to have Mrs. Oladotun Adeosun, MD CEO, Hallmark Hmo. She's going to be handing a. She's Adeosun. She's going to be handing it back over to Dr. Ola Brown. Thank you so much.
Thank you for inviting me.
And then we're going to have Mrs. Bola Odukale, MD, CEO of Capital Express, also board member of Consolidated Hallmark Insurance, handing the plaque to Dr. Leke Oshuni.
Where I roll. I'm very the young lady started yesterday. Yes.
our great moderator, Dr. Kelechi Okoro, we're going to have Mr. Lambe Omoyele, Director of Hallmark Hmo, to present an award to her, a plaque to her. Thank you so much. Such an engaging panel. We would like to call Dr. Emanuela Zamba, the General Manager of Lagos State Health Management Agency, who's ably representing the Lagos State Commissioner of Health, Dr. Aki Emmanuel Abayomi, to give us a goodwill message. Thank you. Please.
Solo. Good afternoon, everyone. I bring greetings from the Honorable Commissioner of Health, who, because of conflicting assignments, is not available to come for this event. He would have loved to come here. Move back. So he has asked that I represent him, and I will now go ahead as an obedient civil servant to deliver this goodwill message on his behalf. I read. It gives me great pleasure to be here today at this important stakeholder engagement, and I'll start by appreciating the contribution of all of us to a healthier Lagos. Gatherings like this are important to reflect on our journey towards attaining universal health coverage in our state and brainstorm solutions on how we can navigate the challenges we currently encounter. The theme of this gathering is strengthening health systems to improve well-being. As we all know, the World Health Organization has delineated 6 building blocks that make up a strengthened health system. Our focus here is on health financing, which I consider highly essential alongside the leadership and governance block. As a nation, we have been battling for so long with the challenges of poor health financing, which has affected both the demand and supply sides of health services. We have one of the highest out-of-pocket spending globally on the demand side. At the same time, a wide health infrastructure gap, brain drain of medical professionals, and other challenges characterize the supply side. Health insurance is a health financing system that can contribute to solving these challenges. But health insurance needs numbers, driven by subsidization and coercion, to thrive. As a nation, we have struggled to increase the uptake of health insurance, especially in the informal sector, which dominates our economy. As all of us would attest, there are no effective, tried and trusted approaches to increasing health insurance uptake in these climes, besides ensuring the mandatory nature of the scheme. However, the question of how to and the will to make health insurance mandatory remains. organized system for the sponsorship of health insurance in the informal sector by philanthropists, corporate organizations, and Nigerians in the diaspora. We hope to generate enough traction for the uptake of health insurance in the informal sector through these initiatives. Over the next couple of months, we will commence advocating to the private formal sector to emulate government and pay for their employees through joining the Ilera scheme. In October 2020, Mr. Governor launched the regulation of health insurance in Lagos State, first of its kind in the country. Currently, we are in collaboration with the health management organizations as partners in implementation. Through regulation, as backed by the Lagos State Health Scheme law, all residents of the state must have one form of health insurance, be it a private health plan or Ilera plan. This will not only address informal sector uptake, but also serve as a tool to compel corporate organizations to comply with the state's health insurance for all mandate. I hope that our discussion today already now will generate fresh, innovative ideas and actionable points that the private sector and government can implement to improve the uptake of health insurance in our dear state, making us a model for other states of the Federation. It is such a pleasure to be part of this occasion, and I wish us a great celebration this evening. Thank you, and God bless us all.
A round of applause once again, please, for Dr. Zamba, ably representing Professor Abayomi of Lagos State. I think, honestly, we all know and believe that Lagos State is really the epitome of innovation in the universal healthcare space in Nigeria, and for the work that is being done, I think they deserve a round of applause again. Hopefully, a lot of states will be able to take lead from what they've done, and we will be able to, if not from a national level, then from a state level. Again, just as a token of our appreciation for your presence here and for the great work that you, Professor Abayomi, and the Commission of Health is doing in Lagos State, we would like to call our GMD and Chairman, Mr. Eddie Efekoha, to please give a token of our appreciation to Professor Abayomi through you, ma'am. Thank you so much. Ladies and gentlemen, thank you so much. You've been such an amazing crowd, and it's been such an engaging event. Just before we break for dinner, would like to invite a poet in our midst, Chemistry, to provide us with some entertainment with a poetic rendition. Please would like Miss Chemistry to join us. Round of applause, guys.
Okay, good evening, everybody. I know it's a great privilege for me to be here today. Looking at where I'm coming from, I don't think I deserve to be here, but I know it is God that brought me here today. I deserve to be here. And I want to say thank you to everyone. I want to say thank you to Mrs. Johnson for inviting me here. When she contacted me for this, and she was like, how much is your pay? At the end of the day, she said, you deserve more than that, you're worth more than that. And to me, I was just like, okay, there's somebody out there who doesn't know me that much, and she's saying more than what I believe about myself. So I'm so grateful for the LD conversation I had with her. So I want to say, can we please clap for Hallmark for this? And I want to especially greet I can't recall her name. This is the second time I'll be meeting you. For the first time, it was at work. So I want to greet you specially. So today, because I noticed it's a corporate event, so I will not be that rugged or that harsh. So I'll be gentle today. I'll read like one of the doctors. Okay. Okay, my point, doctors. I knew a talented boy. His vision was to explore the universe. Every morning, he launches his kite to the sky. He believed he was a born astronaut. He saw his wings and his dreams through soaring kites. But one day, he fell ill, and we were told that the hospital equipment fell below the standard of his sickness, so we lost him. Just like that, his dreams, his life, vanished. My friend Chinasa, she was an exceptional footballer. She played football, and every match she played with a lion's heart. Just one day, our legs were roasted to the bones. From our feet to our thighs remained skeleton. It took India for Chinasa to run again. The other day, there was an accident on the expressway that expressly claimed 18 lives. These are people, not numbers. It claimed 18 lives because the emergency units aren't ready for emergency here in our country. Death is a fast-rising artist, taking people's lives like stage. Or what is this? In this day and age, infant mortality is 56.220 deaths per 1,000 live births. What about the ones who never made it? Our country holds 2.4% of world population. In the same vein, contributes 20% of global death for pregnant mothers. What more reasons do we need before we can strengthen our health sector? Adult mortality in 2020, 34.25 deaths per 100 population. What stronger reasons do we need? What is this? The sensitivity. What about those who never made it to statistics? What about unfulfilled dreams? What about the ones with the possibility of surviving and we ended up grieving? And we want to talk about dreams. Our dreams cannot flourish without healthy body, because dreams are merely apparition of the greatness inside of us. Health is the vehicle for transporting our dreams into reality. Ambition without health is dead work. So why are we treating our health as miscellaneous expenses? Ambition without work, ambition without health is dead work. So why are we treating our health as miscellaneous expenses? Why can we stand as a society and banish this desensitivity? Because a society that abandons its health sector and expects long life is merely a cosmic joke waiting to explode. Thank you.
Sorry, please reduce the music. A round of applause, another round of applause for her. Please, if you people listen to that thing that she said, I was surprised that you people clapped, because my hand was on my chest like this as she was talking, because it was so moving. Please, another round of applause for her. Poetry meets data. Please, a round of applause for her. Please, very impactful. I hope the people that are supposed to hear it heard it and will do something about it. Very impactful. So before we proceed, would like to acknowledge the presence of Muslim Market Cooperative Society with the coordinators, Mrs. Ojomo. I feel like I've missed some people. I'd like to acknowledge the presence of Mr. Awoshika, Lashmark Consultant, and all other protocols for them. Would like to take a quick word from HMO, from Hallmark Hmo, after which we'll break for dinner. So would like to take...
Introducing Hallmark Hmo. Hallmark Hmo is a leading health insurance company born out of the need for quality health maintenance services in Nigeria. We thrive in providing affordable and robust healthcare plans for all Nigerians. We are Nigeria's first choice HMO provider for quality and affordable health insurance services. Our mailing address is 264 Ikorodu Road, Obanikoro, Lagos. You can visit our website on www.hallmarkhmo.com. info@hallmarkhmo.com. Nationally licensed HMO, financially equipped to handle large portfolios, backed by an insurance company of repute, fast-paced with focus on quality service delivery, technology-focused, 13 branches spread across geopolitical zones, present in 6 geopolitical zones of Nigeria. Our competitive edge: a fully automated system that ensures efficiency and flexibility. We have a track record of consistently paying claims as at when due. A crop of seasoned and well-tested professionals. We have over 154 years experience in various fields of operation. Top-notch customer service support guaranteed. 24/7 contact center operations, free advisory services on medical treatment and health, insurance risk management. We guarantee robust medical health insurance coverage at highly competitive rates. Vision: to be the first choice HMO provider in the country. Mission: to provide quality healthcare services, thereby reducing anxiety and creating value for all stakeholders. Hallmark HMO corporate plans: Hallmark Diamond, Hallmark Emerald, Hallmark Topaz, Hallmark Ruby, Hallmark Beryl. Highlights of corporate benefits covered: general and specialist consultations, prescribed medications, management of chronic conditions, hospital admissions, diagnostic services, maternity care and child care, physiotherapy services, accident and emergency care, optical and dental care, ENT services, surgeries, annual health checks, annual premiums and overall financial limits. Other services: food handlers tests, employment-related health screening, ambulance services, management of industrial and site clinics, wellness packages, travel insurance. Here are some of our direct clients, and these are some of our outsourced clients. Thank you for making Hallmark HMO your choice HMO. Hallmark HMO, providing quality healthcare services, reducing anxiety, and creating value for all stakeholders.
Everybody, we're breaking for dinner now. We're going to be doing it table by table so that it's orderly, and we're going to have some light music in the background to aid digestion, and then we'll wrap up in a few minutes.
Hello? Hello? Hello?
Ladies and gentlemen, we're joined live from the UK by Dr. Abiodun Fakokunde, consultant obstetrician and gynecologist with North Middlesex University Hospital, Edmonton, London. He is a consultant gynecologist and obstetrician with the NHS based out of the United Kingdom, and he's joining us live feed via Zoom.
Okay, good afternoon, good evening, everybody. Thanks for the opportunity to actually be part of this highly illuminating discussion on strengthening health systems in our country. I listened to a lot of the participants at the early day, at the part of the in the last half an hour, and I must confess, it's as if we know the problems, we just need to find a solution. And nothing like this. I mean, what we are doing today is actually the answer to some of the problems, because by engaging stakeholders, at least we know where everybody is coming from. A couple of questions came out during the discussion, which I'll probably talk about before as I asked you, I was introduced, I practice in the UK. And the NHS, somebody did mention, is the greatest and is one of the largest employer of laborers in the world, and which is quite true. It provides a lot of, probably covers about 12% of the population in terms of job. And but health care delivery is paid for by everybody in a nice way. And because it is actually effortless payment, in the sense that all of us pay insurance, as part of the salary. It doesn't matter whether you work in formal or informal sector, because you have to borrow money from the bank, you have to provide documents to show that you are paying your insurance payment, and also you are paying your pension scheme, you are involved in one pension scheme or the other. So invariably, everybody pay, and you pay tax, of course. So invariably, everybody pays for health. So to say, the NHIS that is in Nigeria and the HMOs is anchored around the American system, which is a little bit different to what I'm used to in terms of practice. But somebody rightly mentioned, American poor actually suffer one of the worst health inequalities in the world, especially from the developed world. So it's not comparable. And I think to run any HMOs the way we want to run it, we have to have a very strong healthcare system. And the healthcare system, I actually enjoyed the discussion from the preventive and social medicine lady, Professor Olawoye, when she spoke about, health system. Because when we look at our own health system structure, it's very, very difficult to run insurance system effectively with it. Our primary healthcare structure is not, and the referral pathway is rather weak. You can go to almost any hospital for anything, malaria treated in UCH, or ingrown toenail at any private hospital. For insurance to be effective, we all have to go back, and that's why the government needs to help us to make it work, because the structure that on which insurance is anchored is actually a function of a system. So the way we are working with it, HMOs can, I think HMOs can still make a lot of differences in terms of how healthcare structure is developed in Nigeria. I did a work recently looking at the health finance in Rwanda, and surprisingly, 95% of Rwandese actually have health insurance. And they have equally number of poor people as we have. Somebody did say 60% of Nigerians are any less than $1. But the bottom line is that a lot of people within that system are supported, because every community knows who their poor people are. And what they've done is they actually do what they call stratification of the wealth of the community. So there is a banding, and they call it Umbud. It's a very nice long name. I can't remember it now. Umbuduese or something like that. But what they've done is they've structured and they've given power to the people within the community to identify those who are on level 1, level 2, level 3, level 4, level 5 of a social class. And then they were able to take care of the social classes 4 and 5 effectively. So, and to make it work, they actually, and Dr. Olawe also said something about not everything is by doctors. Because if you set a target with it, in which case the universal health coverage target, in which case everybody must be immunized, all women must have antenatal care. And all these things are actually practical and is very easy to run around with. But we need a structure that works with it. And the NHS in UK has been on since 1955. But people forget that the history of NHS was actually funny, because up to now, the general practitioners are still not part of NHS, so to say. They are actually private employees. They don't get salary from government. They are actually paid for the number of patients within the community they look after. So the system can be incorporated into private work in a nice way if there is a good regulatory system that makes primary health care function as primary health care. And I think that is where the system needs to strengthen itself, that we know who our primary care providers are within the system. The only NHS hospitals are actually the district hospitals and the community hospitals, which is the secondary care level. There's hardly any primary care hospital that is actually funded directly by government, even though all the patients are paid for. So there is a way we can work with it, but we need to sit down with ourselves and say which way forward do we want to go with our healthcare delivery. Everybody deserves good health. And I like the idea that if we can buy cheap fuel, we should be able to buy cheap Panadol. We should be able to buy all sort of things that can, make our life worth living. And without that, we would be struggling with our own delivery system. The poor needs to be taken care of. HMOs can actually work with different organizational bodies to make sure that everybody is included. And the proliferation and the diversity of it is quite a good thing, as somebody mentioned with a mobile phone. And a lot of people abroad actually are willing to pay for their family members. When my uncle was alive, I paid for his HMO's services for the last 5 years of his life with his wife. So I'm very sure, well marketed, a lot of people can actually purchase stuff for their relatives. And there are so many community organizations, thanks to internet, which we should tap into. Because, in every community, there are social groups. I come from a small village near Elisha, Fort Erin. In Erin, we have Omerin kind of assembly. And people put money into that for community development. There's nothing that says we can't market HMOs through such community development groups, so that people who are poor can be supported and everybody has good access to healthcare delivery. I think we just have to think a little bit outside the remit of what is possible, and then we can come with solutions that will support our poor as much as our riches. That's all I will have for the meantime, but I'm happy to take questions if needed.
Ladies and gentlemen, Mr. Abiodun Fakokunde, thank you so much. Your input has been so enlightening. Thank you so much for joining us and for sharing. It's given us further insight into how the NHS works and potentially some ways that we can incorporate those systems to develop our own healthcare, even our own HMO systems, and particularly potentially for Hallmark Hmo. Thank you so much, sir. And just as you've mentioned with the community groups, we would like to just again mention that we do have some community groups here. We have the Mushi Market Cooperative Society members. And when we're able to engage this type of groups and we're able to provide healthcare at the grassroots level, then we'll really start addressing some of these issues more holistically. So thank you again for joining us all the way from London. Technology is really making things happen. Round of applause. Thank you so much.
Thank you for the invite. I appreciate it. Thank you.
Thank you. So we'll continue with dinner and some light music to aid digestion. Don't give us Jim Jim. Tone it down. and gentlemen, would like to ask Mr. Tunde Daramola, one of our board members, to please assist us in presenting a plaque to the representative of Professor Sambo, the Executive Secretary of NHIS, Mrs. Catherine Tazamado, who is the State Coordinator of the NHIS Yaba office. Ladies and gentlemen, a round of applause for Ms. Catherine Tazamado. Thank you. Thank you, Mr. Daramola. Thank you, ma'am. Ladies and gentlemen, we would also like to acknowledge the presence of Dr. Abiola Idowu, Executive Secretary of Health Facilities Monitoring and Accrediting Agency, Health Pharma.
I have my goals, yeah. I've made good plans, yeah. I've got the world to conquer. No ailment gonna stop me, no barrier of me. My well-being assured, my healthcare is for sure. If you want quality health maintenance service, Hallmark Hmo, yeah. Hallmark Hmo, live life, my brother, love.
Call us on 090 Hallmark HMO or visit www.hallmarkhmo.org. Hallmark HMO, your health is our priority.
Ladies and gentlemen, thank you once again for staying with us this long and for being here. We would like to especially thank Hallmark HMO for inviting us to such an impactful and power-packed session. And when we speak of an organization, there's usually one person that personifies and embodies the organization, and in this case, that person is Oladotun Adeogun. And we would like to give a huge round of applause to our MD. And I would also like to call her up to give us a word or two as part of our closing remarks. Ladies and gentlemen, Mrs. Adeogun.
Good evening, everybody. All right, I hope the food will not distract us too much. I hope we've been having a wonderful time. Okay, good. Thank you very much for coming. It's been an interesting evening, and I would like to, on this note, appreciate all our guests, both physically present and our virtual attendees. On behalf of the board and management of Hallmark HMO, and by extension, our father, we are going to come out with a campaign. The campaign is, who is your father? And who is our father? It's Consolidated Hallmark Insurance PLC. So on behalf of the board, we do not take it for granted that you have sacrificed your time to come down to the island on a Thursday evening to spend some time with us as we engage with one another, our regulators, our clients, our industry representatives, our corporate organizations that are here, our valued providers. Some came all the way from Ota. He was on the table with me. Unfortunately, he had gone because of traffic. And various partners that we have, our sponsors, Advantage Health, Consolidated Hallmark, CHI Micro, Grand Treasurers Limited, 121 Nitro. We appreciate your sponsorship and we value your presence and the cordial relationship we have shared. We want to acknowledge our panelists and all the speakers. All the way from UK, we had Dr. Fakunde. Their display of wealth of experience on the issues of strengthening health systems has been phenomenal. Indeed, we all are involved in the ecosystem and should play our role in achieving access to healthcare across all strata of our economy. I wish you join us in our various capacities to start with our CSR. A lot of us have said what we are doing, we can increase whatever budget we have for it. And guess what? Hallmark HMO is here to partner with you to provide healthcare to communities around you. You can give us a call, we can come in and have that conversation. From all that we have discussed today, we can safely say that there is light at the end of the tunnel for our health systems in Nigeria. If everybody puts on the need to make it a priority, just like we have heard today, advocacy is very important. We hope that when we call on you again, you will oblige us. Finally, my appreciation goes to the Hallmark HMO team and the CHI team that supported us in planning this event. It's been a wonderful, wonderful, successful event. Please, if you are working for CHI, Hallmark, please put your hands together. It's a wonderful experience. So, on this note, I wish everyone a stress-free trip back to our destinations. God bless.
I know we're all eating, but please, we can do a bigger round of applause for IMD. For IMD. Just in addition to what she said, anyone that works with Hallmark HMO or Consolidated Hallmark, please stand. I think you all deserve your own round of applause. Directly affiliated staff, please stand and take your flowers. We appreciate you. None of this would have been possible without you. A captain is only as good as her team. Thank you so much and well done. Please enjoy the rest of the evening.